So we're here with Jamie Blair and Robin Stephens. I'm pretty sure you've went over this countless times, but for viewers that are just meeting you both, how did you each find your way to Put People First PA? I guess, Jamie, we'll start with you.
Sure. Again, thank you so much for having us. My name's Jamie. I live in Delaware County in Lansdowne. And I found my way to put people first a bit over a decade ago. And actually, after I had a healthcare crisis in my own family with a cousin who got really sick and saw how that affected my family. And then I was looking for a community of people who knew the way we were being treated by the system wasn't right. You didn't need to have all the correct ideas. You didn't need to have the solutions, but that there was a place for you to join in to fight for our healthcare rights. So that was an early entry point to me to put people first.
Robin, how did you experience that differently?
Well, first of all, I was invited to go to Washington, D.C., and that was my first encounter with Put People First. And then we went to Harrisburg, and I was just so impressed with just the loving, kind people of all different walks, all different kind of people, all different flavors. And I was looking for something to do when I got retired. I was so busy working all of my life that I really didn't have time to devote to my beliefs and I had no time at all. I was just busy working, raising a family. So when I retired, I said, this is something I want to do. And just so happened it coincided with a meeting they had, a rally they had in Harrisburg, and I just bought in because I love our philosophy. I love the fact that we believe in putting people first, putting people over profits, and we're just a very loving, kind group of people that want to see people do well and want to see people have the rights that they deserve: the health care, housing, clean water, clean air. We
And
fight them
one of the
all.
most fascinating things that I read about Put People First is that most advocacy groups kind of run top down. You have experts and staff sort of decide strategy, and then you have members that show up to the occasional rally and don't do much else for the group. And I read that Put People First is a statewide, member led, and staff free. How does that actually operate in practice?
It runs really well because we care about what we're doing and we don't have any big I's and little U's. And we realize that we need each other. We're responsible for the energy that we bring in, for the work that we do. We're responsible for it. We don't have anybody, telling us what to do or how to do. We come together and we're looking to find solutions for a crisis that is, happening not just in Delco, but statewide, really nationwide.
To build off of what Robin's saying, I often tell people when they ask about Put People First, I actually pay money to do this work, which is a shocking thing, but exactly that we are staff free and we're member led. So we pay membership dues. I mean, anything you got. So it's $2 a month to $20 a month, whatever it is. But it's the commitment based on what we know we need in our communities. And maybe we'll discuss more of this later, but the way we decide also on our campaign work, that's all a consensus-based process that starts with our healthcare rights committees, which are geographically located and goes through the whole organization, involves a reflection process on the year before, as well as an ongoing study of the terrain of, well, what's happening in our communities, as y'all talked about first around data centers, et cetera. So anything that's affecting our healthcare struggles, that may factor into what we're focusing on in the coming year or years.
And healthcare, specifically Crozer, not everyone knows that it closed, but not everyone knows the backstory. Will one of you kind of just walk us through what Prospect Medical Holdings did starting, I guess, in 2016?
Yeah, I'm happy to kick that off, and Robin, feel free to chime in. So Prospect Medical Holdings came in and bought up our hospital system in Delaware County in 2016. Prior to that, it was a nonprofit hospital system and healthcare system more broadly. It's more than just these hospitals as well. And piecemeal, they started extracting as much profits as they could and shutting down first units from these different hospitals and then full hospitals. And so we saw essentially Springfield Hospital was shuttered more or less like in 2020. Delaware County Memorial Hospital. Yeah, really quick. Delaware County Memorial Hospital in 2022, 2023. And then, of course, last May, following Prospect Medical declaring bankruptcy at the beginning of the year, they shut down Taylor and Crozer Chester. And all of that was on the tail of there's just incredible trends with what Prospect and with what other private equity companies do, which is things like leaseback agreements where the hospital system, right? Crozer owned the buildings, the land that they operated out of. Prospect Medical decided to sell that land out from under them and then make the hospitals rent it back. And so,
Repulsive.
imagine if you if you're a homeowner, would you ever give up your house to then have to rent it back from a landlord? I don't
It's an
think
insane concept.
anyone in their right mind would. And that was also tied to, prior or around the same time. And that was, early on, I can't remember 2017 or 2019, but they also, another one of their early shady dealings was they took $400 million from the hospital system to pay out their shareholders and then just saddled the hospital system with debt. And it's credible. And in Pennsylvania, actually, there's been some pushes for legislation, but right now there is no laws on the book that say this is not allowed to happen.
That's unbelievable. Robin, do you have anything to
Yeah.
add?
Yes, because
I'm
also
sure that's a loaded question.
they gave 3 of their CEOs right before they filed for bankruptcy $10 million each, which, they extracted all this money from the citizens, really, of Delaware County because it was their community hospital. It's a community hospital. And it's just really sad that these profiteers came in and, within 10 years, totally decimated 4 hospitals.
And now we're a maternal and infant healthcare desert.
Yes, very true.
What are some of the human costs that you've personally witnessed? What are some stories that have stuck with you? Because a lot of people can hear, oh, Crozer closed. If they're not affected or they don't hear his story, they don't really care.
I'll start. We meet with the community. We do what we call base building. So we're out in the community on a regular basis, and we ask people, how's it been? We actually did a little speak out teach-in around the year anniversary, and so many people are just not receiving any care. Because not only was Crozer a hospital, and it was a premier burn center, and it also had a mental health component to it that people would come in and receive their treatments. They would receive their medicine. I remember one time we were setting up a table and a woman couldn't wait. She couldn't even wait for us to set up. She said, I don't know what to do. I can't find a doctor that'll take my insurance and I'm running out of my medicine. Things like that. Things like people, one of the women we met was she had a heart attack. She lives in Chester. She was immediately taken to Crozer. She said, what's going to happen if I have another heart attack? Will I make it to Riddle? Will I even get a chance to be seen? Gunshot victims. I mean, unfortunately, that's just a reality of what happens in Chester, and those victims aren't making it either. I mean, it's just too far to travel.
How long does it take to get from Chester to Riddle?
About 40 minutes.
45 minutes? Yeah.
Yeah.
Wow.
Yeah, and that's what
Philadelphia.
Go ahead, Jamie.
Right. I mean, just to add to that, and that's 40 however minutes long in a car. For everyone who doesn't have a car, on top of our public transit being gutted, it's we heard stories of folks who, okay, I have to now my doctors are in Philly and I have to take 3 buses and a train to get there. That is an all day endeavor. And you can do that potentially if you are well, but if you have, mobility needs or if you're in a crisis, that's not going to fly in an emergency.
Or a $150 Uber, and who can afford that?
How about
right. Yeah.
And the craziest thing that I read was that the hospitals were sold off. One became a school district property, and then another site was reportedly used for police dog training. I guess, how do you make any sort of sense of that?
It's ridiculous. I mean, that is so exactly the Upper Darby School District bought Delaware County Memorial Hospital. So in some realm, it's great that that's going towards public use for school building space. But that being said, Upper Darby is huge. It's the 6th most populated municipality in Pennsylvania, and we still don't have a hospital there. So, and then with Crozer Chester, there are potential plans for a rebuild. We've heard a little bit, maybe we'll get into that later. But in the meantime, exactly, we've seen police dog training going on there. And not only, we first actually saw someone else posted a video online, and then some of our people investigated themselves and were like, this is really what's going on in a building that was fully functioning as an emergency room just 6 months prior. And now, instead of doing the critical work to just get it up and running and fill this need, instead, the owners of the building are bringing in some extra money, training police dogs there.
Robin, do you have anything to add?
Just that I really feel as though it's a travesty that people cannot go to a community hospital, that we deserve hospitals in the communities where we live, and just that we study this, and this is a trend. Like I said, this is happening. It's happening where I live. 3 hospitals have closed just in Norristown in the past 10 years. They're talking about closing. The Pottstown Hospital is going to close. We have confirmation from one of the state reps in Montgomery County that, you know, and they said Phoenixville might be right on its trail of that. And we see what they do. They cut back services. Maternity is always the first to go because there's no money in maternity. And then they cut back like emergency care, ICU, cancer treatments. They've done all that at Pottstown Hospital already. And I just feel
When are they closing that?
that we don't know, but we know it is going to close. They haven't given a date, but that's the pattern that they follow. They cut back on services, and then little by little they just sell off all the assets, and then they close the hospital. I would think maybe
Unfortunate.
within the year, from just the way it happened in Chester and with Crozer and other hospitals, that probably within the year I can reach out to the rep and ask him if he has a date. But I know that other people were saying the same thing, and I have a friend that actually works for Tower Health, and he confirmed it as well. So it's
No,
known. I think,
he's got all the details then.
well, not all the details, but he has a few.
Fair. So the last hospital that closed, the Crozer 8 situation, what happened on September 8th? Can one of you walk me through that?
JJ,
Robin, go for it.
We were both
We
there.
were.
We were both there, and we just decided that we wanted to highlight the fact that there's not a hospital. We went in and we were very peaceful. We weren't, because there was some activity going on there at the time. We didn't block any patients' ability to get to their doctors or get to the front desk, the reception desk. We just sat down and we were, singing some songs and, talking about people's stories, and they arrested us.
And I'll add to that. And just to add context, so Crozer, the whole Crozer system shut down. We were in a building connected to the complex where there were other services that were still open. And so again, as Robin said, we made completely clear that we wouldn't obstruct any patient's ability to get where they needed to go. But it was, we made that decision after months and really years, because we were out on the scene in 2022 and earlier when this first round of cuts came down. And again, when Delaware County Memorial Hospital shut down and when units from Taylor and Crozer Chester were also closing at that point. We've been involved in this hospital fight for years. And as the hospital shut down, and as we talked to community member after community member, and we talked to electeds and other power holders, and the electeds had no solutions for us. And community members were just outraged about, first before the shutdown, they're like, no, like some people who we talked to, they were concerned. Other people were like, there's no way in this country, in this county, there's no way our hospital could close. And yet it did. And so once that set in, that people just saw, like, what are we going to do from here? And as we tried all these other channels, we decided, what we talked about was that we have to answer to a higher law. And so that was part of going in and waging this peaceful, this nonviolent civil disobedience. And they really responded with actually like a surprising amount of force, that we got 3rd-degree misdemeanor charges. The 8 of us who went in, and we were taken and held for a number of hours. They had basically like all of the local boroughs, like police departments out. And I'll say at the same time, we also had this as part of the action. In the lead up, we had 3 different art making events, which were really beautiful in different parks in Chester, where we had grandmas and little grandkids and all different folks, healthcare workers from Crozer, coming out and painting this massive banner that ended up being 20 feet tall by 30 feet.
That's
that
cool.
we hung. It was so cool that we had just like hundreds of different hands on that we hung on the side of the parking garage there, so you could see it from I-95. And it said,
and
"Take back our
the
hospitals."
symbol of community that shows too is fantastic.
I know. And we were like, will the grandmoms, like, how do folks feel? Like, is this too edgy? Absolutely not. People were like, we have to get a table under those letters so that I, like, with my bad back, I can still get in here and color in this art, because this is an important message I stand with. So
Bring
it
out
was
the
beautiful.
edgy
And
grandmas. Bring them out.
amen. They're all over. They're people who are fighting for their basic needs as human rights, who are just like, what's going on will not go. It won't work for me. It won't work for my grandbabies. And like, I'm here to fight for something more. And that was really what we've seen around this hospital fight.
And you've both invoked Dr. King a lot, and the fact that he studied at the Crozer Seminary just down the road. How does that history sort of shape the way you think about breaking the wall, like you said, nonviolently?
We answer his call that, that this is what we have to do. That's part of what we do as an organization is we do civil disobedience. We learn from his example. When a law is unjust, you have to stand up to it. They didn't hold those people that stole all that money. They're walking around with their pockets nice and fat. We just wanted to highlight the fact that people deserve a hospital. I just don't think that's a foreign concept. You know what I'm saying? Like, people that live in a community deserve to have a hospital if they have an emergency that they can get to, or if they're having a baby. I mean, a lot of people don't realize that Crozer was a premier burn center. And one of the firefighters told us that, God forbid something happens to one of his men, the closest burn center is in Lehigh Valley.
Yeah, that's too far.
Way too far. Way too far.
It's like 3 hours away.
We lost a lot. The community lost a lot. People lost their jobs. Just not good. The businesses around the community. We also frequent businesses in the community. We try to support them as well. And they told us that they've lost a lot of business because the doctors and the nurses aren't coming in. A diner that we frequent said, which I never thought of, that patients would actually order food and have it delivered because they're so close to the hospital. And they've lost a lot of their business as well.
And I
Jamie,
want
do
to
you have
go
anything?
back to, I just want to go back also to what you lifted up with MLK, and that part of, right, you can actually see on our shirts, our organization is called Put People First PA, as you've been mentioning, and we're part of building the Nonviolent Medicaid Army. And that does harken back to MLK's nonviolent, building an army of the poor, or a freedom church of the poor. He called it a few different ways. But that's this understanding that those who are ready to, really change this system are those at the bottom with the least to lose and the most to gain by a fundamental restructuring of society. And so we think about that as the Nonviolent Medicaid Army. Whether you're on or unfairly excluded from Medicaid, it's people from all different backgrounds. It cuts across all different lines of race and geography, age, sexuality, religion, political party, like you name it. It's the people who are affected by these crises. And through taking action together, whether you come in with ideas that I agree with or not, if you are hurting because your hospital closed, like, that's the basis on which we can work together. And through that, may we be transformed to really understanding what we deserve, which is so much more than what we're given in this society, and then fight for that.
Yeah, and I've read that you guys draw a sharp line between charity and organizing. I've read a quote that not you, but your organization said that we don't take the place of social workers. Why is that distinction and line important for you?
I'll take some of that because we're the poor organizing the poor. I mean, yes, we do, advise people. We help people when they get unfairly cut off of their Medicaid or their SNAP benefits, but we're not social workers. We're here to change society. We're here to organizationally get together with people that are just like us, that have, for years and years and years, just not gotten what we deserve. And so we don't do social work. We're not taking the place of social workers. We just care about people. So because of that care, it extends to when we can help somebody, we do. But it's not social work. And like Jamie said, we all are
Yes.
proud dues paying members. We are. Yeah,
And
and go ahead. We do a lot of work. We do. We definitely do a lot of work. I do a lot of work, and Jamie does a lot of work. But we love doing the work. We do, because it's so rewarding.
And to exactly what Robin was saying, I mean, we're not aiming to take the place of the state. We're not aiming to do the government's job. We actually believe that, like, they have the obligation to help us meet our basic needs. And so that's we're not trying to step in. We're not trying to provide all the basic services. We use these things, like we've alluded to, I think, these people's clinics that we do, where we provide basic healthcare services. We help people sign up for benefits, and we have a space where people get to break their isolation and share their healthcare stories. And part of that signing people up for benefits and really the whole package, but it's to help agitate people, help see that, like, again, as we've said already, no, you deserve more than this, and that the state should provide that. And so we don't say, let's just let them off the hook because they're happy to not have our needs met, but instead to be like, oh, no, no, you have a responsibility to we the people, and we're going to hold you to that and push to expand that.
Yeah, I was also fascinated by the way that your organization goes about organizing through seasons. Can you walk us through the arc of the year a little bit?
I can take some of it. Yeah. So we do a lot of different things. We all, our main thing is our base building season, which runs from, like March till September. We have educationals that we do. We definitely study history. We study our people's history. We study the history of what that's why we know what's going on with these hospitals because we've been studying it for years. We also have a membership assembly in October that's just beautiful where we all come together and we do fundraising. We do, our main thing is political education, base building, and fundraising is important, but that's not the main focus of what we do, you know.
You are truly a multicultural organization. How do you guys even do that in a place as polarized as Pennsylvania?
Love.
And
That's
I mean, it's our main focus being healthcare, right? Like actually when Put People First PA started off over 12 years ago, 13 years ago, there wasn't a defined campaign at that point. It was actually people who knew each other from across the state who said, okay, let's have dozens and dozens more conversations with people in our community to see what are the needs that are bubbling up most. And it was healthcare that came through. And that's really, and then healthcare that was decided as the campaign. Because the thought is, any door that you knock on, the person behind that door is going to have a healthcare story. Like if you've got a body, you need healthcare. And so that's again, we organize people on the basis of like, are you hurting? Do you have a story to share? And then we all go through a process of transformation through our organizing.
Do you have anything to add?
but just the love. We really do love our class. We really love our people. We love each other, and then we also that love spreads out to everybody that we're trying to organize, people that we meet, and people see that. People see that we're genuine. Do you know what I'm saying? That we
Yeah.
truly care about what's happening in our communities. And I think
And
that's
your
what really
organization, you guys are politically independent. You don't carry water for either party. Why? And what sorts of things does that cost you? I guess
It's a
start
good
with Jamie.
question. Yeah. I mean, exactly. We're politically independent, so we hold all power holders accountable. That is so key to our DNA. We believe that no one's coming to save us, right? And again, what we said before, that the people who have the least to lose and the most to gain, like we are the folks struggling in our communities who are going to make that difference. And while I do, we have friendly relationships with various electeds in our community. We do absolutely try to form relationships, especially to then hold those power holders accountable. But if you look back to last summer and last spring and the meetings that we had, whether it was with Delaware County Council or Governor Shapiro's staff or our local electeds, while all those folks were like, this is so important, this is devastating that our hospitals are closing, none of them were able to do a thing, whether it was they lacked the political will or they lacked the political power. I mean, those are conversations that we can have. But it was really, why would we line up behind one of these folks when they're not actually going to provide the solutions? And we know that that's something that needs to come from us.
I mean, the biggest disassociation from reality to me is Delaware County has 4 hospitals that closed, and Mary Gay Scanlon still has not signed on to the Medicare for All bill. It's crazy to me. Robin, did you have anything to add?
no, but that we just really do believe. I mean, we're cordial with anybody that wants to talk to us, talk about our needs and what we're trying to do. So it doesn't really matter because, like Jamie said, nobody's coming to save us. There have been Medicaid cuts under all administrations, whether it be Republican or Democrat. And we just deserve so much more. And the only way we can do that is by holding all power holders accountable. And it's attractive to me that we're not affiliated with any one political party.
One of the things that resonated with me was at the Upper Darby Vigil, you connected hospital closures to ICE and immigration. Why was that important for you to link those fights rather than, I guess, keeping them separate?
Because they're healthcare crises as well. You know, a lot of immigrants, unfortunately, they say, you know, that's why we don't have healthcare because the immigrants took our healthcare. No, if you're no, you can't get healthcare if you're not properly documented. If you show up in an office, they're going to try to deport you. And now with ICE being on the rage, they'll call ICE on you. Like it just doesn't work like that. And we believe that everybody deserves healthcare, no matter how they're here, why they're here. You know, people, if you have a body, you deserve. And we reach out to all members of the community, you know, and ICE is treating people very cruelly in a lot of these detention centers. They're not getting any health care. I mean, you're hearing about people dying, you're hearing about people not getting their proper medication. They have children in there for you know, why is a child in a detention center? So we believe in human rights for all people. We don't, you know, we don't cut across any lines. We think if you're a human being, you deserve health care, you deserve rights and not just basic rights. You know, our Constitution tells us we're supposed to have the right to what? Life, liberty, and the pursuit of happiness. Well, how can you have life and liberty and the pursuit of happiness if you're sick and you don't have a home to live
Yeah.
in? All right.
Jamie, do you have anything to add?
Nope, I think that was spot on.
Yeah. I wanted to pivot a little bit to the dental benefit fight that you guys are working on. Most people don't realize that PA Medicaid stopped covering adult dental care in, what was it, 2010 or 2011? I guess, what's the fallout been? What have you seen as a result of that?
I mean, so it's tremendous. And I'll get back to, I think this also goes to the question of why it's important to be politically independent and to hold all power holders accountable. That in 2011, that benefit to Medicaid, that adult dental benefit to Medicaid was cut under a Republican governor in Pennsylvania, but that guidance on how to save money in state budgets was given under the Democratic president, Obama, right? And so we see that across the spectrum, there's okay, how do we balance the budgets on our backs, on the poorest backs? And so when that benefit was taken away, pretty much what now is covered by Medicaid, if you need dental, it's gone down tremendously. You can definitely get an extraction covered, but damn, oh my gosh, should that not be a last resort, having your teeth removed from your head as opposed to getting a crown, getting a root canal, and we've also, since previously, you were able to get, I can't remember how often, but partials and full dentures. Now under Medicaid, you were able to get, say
Every
that
five,
again, Robin.
every 5 years.
Every 5 years. Now you can only get a full set of dentures once a lifetime. So yeah, right? And if your body changes, which you will as you are aging, all of our bodies are changing all the time, but your dentures from 5 years before, they're not going to still fit you. And so
No,
we've gone,
let alone a lifetime.
So we've gotten every year they happen. There's these big free dental clinics that we've gone to in different parts of the state that happen. And they have them. One, it's a nice charity gesture from the big healthcare profiteers that are profiting off of our sickness and our dental needs all the time. But they also put on this big charity event where a lot of concerned dental hygienists, dentists come out and they donate their time, which is really beautiful. And then you see, as we do when we've gone year after year, there are hundreds of people who line up, and actually thousands. They see like 2,000 people just in a 2-day period. And you see people starting to line up the night before, like waiting outside a sports arena to get basic dental care because otherwise they have nowhere to go. And and dental care, I mean, it's true with so much of healthcare, but it's a real source of shame for people. Like we had this person, Don, who we met when we were there this last time, where both we went for our members to get care, and also we took people who we had met who needed dental care through online base building and through base building the community. And we met this woman, Dawn, who she starts off her testimonial and she's sharing her healthcare story. And she's like, I'm a person who loves to smile and now I don't anymore. And that's because instead of having, the teeth that she wishes she had, she wasn't able to get the care she needed and they've all been extracted.
And one of the things about Mom, is when people come, Mission of Mercy, we just call it MOM for short. Most people come that need dentures or need partials or need those kind of services. And by 8:30, they do it on 2 days, Friday and Saturday. By 8:30 Friday morning, they had run out of dentures. They only brought 12 sets. So you've got 2,000 people. What are the chances that only 12 people are going to need dentures? And to me, that's just cruel. That's cruel to have people stand and wait in line and thinking they're really going to get the services they need, and then to be told, no, I'm sorry, we can't help you.
State priorities. We talked about data centers a little bit before Jamie came on, but we're set to spend $43 million on data center tax breaks while restoring dental care. I think it would cost around $20 million. What does that tell you about our state's priorities right now?
Not for the
Exactly.
people.
Says it all. Profit over people. Yep. It would be a drop in the bucket to get people really meaningful dental care. That would be the difference between exactly someone deciding I'm not smiling from here till the end of my time in any picture, or getting a job and not being able to, or just having the rest of their, not having teeth and proper dental care affects all parts of your health. And we know that data centers affect people's health, but actually in the opposite way, that they're just, there's so many environmental challenges that we're hearing. I don't need to go further, but electrical costs, all of the issues from data centers. And that's what our state is choosing to fund, subsidies and cuts for them, as opposed to getting us our basic needs.
Yeah, and me and Robin touched a little bit before you hopped on about the Crowd the Capitol event that you had earlier in June. Jamie, I guess, how did that go from your standpoint?
It was a really powerful event. I mean, we do another thing that I'm not sure if we've mentioned yet, but in Put People First, we talk about everything we do to develop leaders. So as you mentioned before, Nick, that we're not relying on professionals or experts. We are everyday people who came to this work because something about it spoke to us, often because of a healthcare need or a crisis. Or maybe we just saw the love in the community and we are called into that to break our isolation. The Crowd the Capitol, first off, it was, about 50 to 60 people who came out with us. At least half of those people, it was their first time going to Harrisburg. And so I think that in itself, a really transformative experience to
Yeah.
be there at the Capitol, to be in this actually priceless building because of the architecture, because of the art, and to be like, hold up a sec. These people work for us. This should be the people's building. And then to actually be given the space where we delivered over 200 healthcare stories. Throughout our base building, we've been getting people to fill out these legislative story cards. So we had 200 some stories that we were delivering to over 60 legislators. And so we had our members going and meeting, and then we had I can't remember if it was 8 or 9 legislative visits that we actually had with both Democrats and Republicans. And so all of our members were either engaging in these legislative story card drop-offs or meeting with legislators, or then we all came together in the East Wing Rotunda to have this press conference, which you're not allowed to call it a rally anymore at the state capitol. They're all press conferences now. But where we also at that point, we had 8 different people from geographically all across the state who also shared their healthcare story. And many of those folks were speaking publicly or sharing their healthcare story for the first time. And so in all of these different actions, not only was it holding all power holders accountable, but it was also each of these folks shifting the narrative, breaking their isolation through telling their healthcare stories, and all of us really developing in our leadership as well. So it was
probably a
really
relief
powerful
for them
day.
to tell their story too.
Yeah. I mean, I think that's the case for so many folks when you're like, I've been taught that this is my individual burden to bear. You share that, and then you have so many folks come up to you afterwards. I see this every time we share our stories. Other people coming up being like, you shared my story too. Thank you. I don't feel so alone now.
And that's the thing, so many people aren't being heard. Everybody we talk to say you're the only group that actually listens to us. We follow up with people, we call people, we email, we text. We continue to build relationships. We're a relationship building organization, and it's so important because people say, "Yeah, you," because a lot of people, they'll reach out to you. We're, gonna have midterm soon, so they'll reach out to you to get your vote or, to solicit money, but then you never hear from them again. That's not us. We
You only
care
hear from
about.
them when they're campaigning.
Right. We care about our people. We care about. That's what really attracted me was the level of care and commitment and love.
So where does the dental bill stand right now in Harrisburg?
So there's two dental bills. There's one both in the Senate and one in the House. The one in the Senate, we were applying pressure to have them push it out of committee. Right now it's in the Health and Human Services Committee, and that's predominantly who we had those legislative visits with. So that's where it's at right now. And we know there's like discussion of how it ties into like the budget for the coming year, et cetera. So that's where it is. And I think we don't know how exactly things will move, but just as you pointed out before, Nick, that it's like less than 20 million, it is literally a drop in the bucket compared to the overall budget and the tax breaks and giveaways that are happening for data centers, that we don't think this is even a major ask that would significantly improve people's lives.
Bare minimum ask, in my
Yeah.
opinion.
Yeah.
And something that we already previously had. That's the thing. It was part of Medicaid. Do you know what I'm saying? And to just take it away like that to me is very cruel.
Oh, it's awful. Now, a year later, none of the hospitals have reopened. How do we win? What does winning actually look like for us? You talked about community-run public hospitals. Can you paint that picture for us? Like, what does actually winning look like?
It's a beautiful question. Exactly. I mean, part of our demand last year was like, and it didn't even start with us. It was already a demand happening in the community. If you recall, there was news around a Delaware County council meeting where a bunch of nurses from Crozer actually put forward this, we want use your power of eminent domain to take back this hospital. People, I think, have been taught often that like eminent domain, oh gosh, that's the government trying to take away my property for someone else's benefit, like for a highway, for something that doesn't impact me in a positive way. And when we broke it down to be like, no, 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 what we're talking about is community controlled. It's eminent domain away from the Wall Street profiteers and for the people. That was the easiest sell. And not only was it not even a sell, it was like people were coming up to us with that understanding. And so that is really, we believe we can't have a healthcare system that is based on a for-profit motive. And so while it is a longer term fight, that is what we're aiming for. We believe that healthcare is a human right. We believe that profiteering should have nothing to do with our healthcare system. And that's what we're going to keep fighting for.
Yeah. Corporations shouldn't get rich off our sickness. That's horrible.
And what's
And I don't know if people know
good?
that there's an $11 billion that if they call it a rainy day fund. Did you know we have an
Yes.
$11 billion rainy day fund in
Yes.
Pennsylvania? Why are you not using some of these funds to help us? Hello, it's pouring. It's more than raining, it's pouring.
They didn't want to use it last year with that budget fight either.
No, they won't use it. And it really boggles my mind because we talked to both Democratic and Republican, and they're like, well, no, we're waiting for our side to get in and then we're going to let them use it. No, there's people hurting right now. What are you talking about?
Use it. What's the point of it if
Right.
you don't use it?
Exactly. And I can only imagine the interest that's compounding on it as well.
Oh,
It's a lot
yes.
of money. I'm
Now,
sorry, I didn't
what's
interrupt you. Just
no,
sort
you're
of-
good. What's one thing that you wish neighbors in Delco understood about the healthcare situation in the county that if they haven't been affected and they don't know yet?
It's a great question. I mean, I guess my answer is a little different. That I just wish that people were able to clearly see that we deserve so much more than the crumbs that we're being given. So, I mean, that's one piece. I also want to say that like whether one of the Crozer hospitals was your hospital, anyone's going to know the moment they go to Riddle how in what a bad shape they are because of the Crozer system closing.
Yes, we hear that from people in the community. When we're out tabling, I had a nurse tell me that they're just overwhelmed. They don't have the capacity to deal with all the extra patients that are coming through and they're not getting the quality care. And like Jamie said, we just deserve so much better than this. We really do. And people deserve, if you have a community, you deserve to have a community hospital. And there was actually
How
some
are they
doctors
dealing with it at Riddle?
yet. were trying to get Crozer at one point. They were trying to pool their resources to buy Crozer.
What does the scene
Yeah.
look like at Riddle? Like, how are they even dealing with this?
They are beyond capacity. From what we've heard, there's beds in the hallways. They have like auxiliary areas that are completely filled up as well. So it's just, they had an influx of funding a number of months ago at this point. But again, from what we've heard from folks who work inside, as well as patients or community members that we've talked to, it's like none of it is near enough. So it's a real, our existing hospitals are overburdened. And I know we didn't get to this point, but the solution of micro hospitals,
Yes, Christiana Care.
Lord have mercy, giving us 10 or 12 beds as opposed to what Crozer Chester had of 400 some beds. Like that's not it. That's not what is going to save the lives that we need to be saving here. Robin got to this a bit before. I mean, it really ties in with what we're seeing with the general trends in healthcare, that the most, that again, with all of it being for profit, that they're aiming to minimize anything that is like higher liability and less profitability and less profit, and maximize what is more profitable. And so also with the plan for the Crozer Chester rebuild, we went to the town hall that Chariot Allaire put on, and the CEO, I think, went over his plan, and he talked about that it would be 10% of the former size of inpatient and 90% instead outpatient. And that's all about maximizing profit. I think that's another piece that I think it's really important for folks to be able to read between the lines, when it's like, yes, folks, really, we need we need care back, period. But again, that we have to hold these profiteers accountable. We have to hold power holders accountable, and we have to expose the profiteering too that's within our healthcare system. That if you're being pushed instead of to have inpatient care where you've got a procedure and then you have time to recover at the hospital, and instead you're being pushed out more quickly. What one of the people on the panel, again, at this Crozer Chester Rebuild Town Hall, was like, people recover better at your home. You recover better at your own home if all your needs are taken care of at your home. For most people, that's not the case. If you go home, do you have sanitary conditions of a hospital? Do you have healthcare providers who are trained, who can focus on your wound care? Do you have meals being provided for you? Like, for, by and large, no, people don't have that at their homes. And on top of it, they probably have like kids and animals that they're dealing with too. So it's really not, it's not what's set up to win when you're like, no, we're going to prioritize outpatient because it's better for the patients. You have to take into account people's whole lived experience to actually do, the real math behind that.
Yeah, they
Totally.
don't want you to stay at all in the hospital. They're trying to like do away with overnight stays. And,
Cleaning
I
that
know
out.
people that have had operations and they send them home I have a friend that lives here where I live. I live at a senior complex. She had her hip replaced and they were trying to send her home that day. And I'm like, no, her anesthesia hasn't even worn off yet. I told her sister, you call them and say, absolutely not. But she was home the next day. I mean, that's just, which is really horrible. What does that say about the level of care that we're not getting? Do you know
That's
what I'm saying?
terrible.
That you have
Yeah, that's awful.
a major surgery and they would like to send you home the same day.
It's unconscionable.
It is.
Now, I do want to be mindful of your time because I do know it's late, or it's getting late. Now, if a listener finishes this and really wants to get involved, what's the first step they could take? I know a lot of people say like, oh, you can sign up on our website, but that's a bit open-ended. And for some people, that doesn't really help. Are there any specific events coming up that people can participate in, show up, talk, and get involved?
Absolutely. So we have, depending on how soon these listeners listen, we have both statewide, we have Zoom events, we have in-person events. The third Wednesday of every month with Put People First, we have our statewide call, which is open to members and anyone who's interested in learning more. And that's from 7 to 8 p.m. It's on Zoom, and you can find out more on our Facebook page, or if you do sign up for our listserv. And that one is actually about the hospital closures. It's called They're Taking Apart Our Hospitals. So if that's interesting to folks and folks are like, what's going on in Delaware County? That's a clear next step you can get involved in. Also, with our national network, with the Nonviolent Medicaid Army, we have these Saturday School of Struggle. And so that's the first Saturday of every month. In July, because of the 4th, it's the second Saturday. So it's July 11th. It's at 1 p.m., but it's generally the first Saturday. And that one is called, I think it's called You Can't Think Your Way Out of Being Poor, but Here's What You Can Do. And so either of those, they're great entry points to people to learn more. And we'll be out in the community too. And you can find out about that largely on our Facebook page or joining the listserv. So we really do welcome people coming out to join us. We will get in touch, as Robin said.
Yeah.
There's always a space for folks to share their healthcare stories too. So if any of the listeners are like, yes, feeling really fired up, feeling impassioned, and want to break their isolation and share what's happened to them, we do Medicaid Mondays every Monday on social media. And that's not just you can be on Medicaid, but it's also just a broader way for folks to share their healthcare stories. And that's another way in. So you can hashtag Medicaid Mondays, or you can reach out to us and we'll get it on our page to amplify your story.
Awesome. Robin, do you have anything to add?
Just that we really do. We feel it's empowering to tell your story. That's how movements start, with the telling of untold stories. That's what we've seen through history. And it's important that people have a space where they feel valued and heard, because so many people in today's society don't feel valued or heard. So we really do put an effort into listening to people and giving them a platform, where they can actually tell their stories, because it's important.
Totally.
And I just want to encourage your listeners to come and check us out, because I love it. I do. It's one of the best decisions I've ever made in my life. I'm 67. I'm one of those
Yeah, I'll put
grandmothers.
your I don't know where your invite or those events, Jamie, that you explained, are they on your website?
They're not on our website. We are revamping our website. So coming soon, those will be up there in the next few months, but they're on our Facebook, or if you sign up for our listserv, they'll be on. But I can definitely share the links with you.
Thank you.
Awesome. Well, we have been speaking with Jamie Blair and Robin Stephens of Put People First PA. Both of you, thank you so much for joining me.
Thank you,
for
Nick.
your
This was awesome.
Yeah, it was awesome, and we appreciate your time.